South African doctors in private practice have strongly opposed the National Health Insurance Bill, claiming that about 40% of doctors would immigrate if a universal healthcare system was implemented. Well, the SA Medical Association, which represents 17,000 doctors across the country, says the organization could not support the bill as it was tantamount to creating a monopoly in the healthcare sector. Well, for more clarity on this, I'm joined in studio by SAMA Chairperson, Dr Angelique Coetzee. Good afternoon. Thank you for joining us, Doctor.
Good afternoon, Liezle, and good afternoon to the viewers out there.
So, upon the Minister of Health's announcement in August last year, there's been major concerns from various parties, some for it, some opposing some of the strategies in place to implement this. As the South African Medical Association, what are some of your major concerns with the NHI bill and with the intention to perhaps afford universal healthcare coverage in the way that they plan to?
Currently, to understand us, SAMA is a membership organization. It's driven by our members. We did a short survey under our members as to help us with our submission to Parliament regarding the recommendations from our member side on the bill. So on this recommendations that we got from our members, one of the biggest concerns of the members is actually the fraudulent or the corruption that is currently being seen in the sector or in the healthcare sector. But it's not only in the healthcare sector, it's also driven by the other SOEs like Eskom and SAA. If we look at that as a role model of what and how government implement, then that is areas of concern.
So there's a lack of trust.
There's a lack of trust, and it doesn't matter how many times the minister is assuring us that the NHI bill will not fall under the normal SOE regulations. It will be a separate entity. And this is now, again, looking at the history that we have in government, it still doesn't get the message through. And as I said, our members are extremely concerned about this. It's not that we are against universal health coverage or universal health access. That is a very important aspect of healthcare, and we are all for it. The current bill, in its current format as it is, looking especially into the lack of trust that the doctors got into the system, that's where the problem is lying.
So we're looking at some of the means that it will be implemented. We saw that the minister's saying it will be run as a non-profit organization. It will have a centralized figure, that will issue, or centralized fund rather, that will designate the funds to the various stakeholders, and also within a provincial level and district level as well. Just in terms of the feasibility, the timeline is 2026, if I'm not mistaken.
Yeah.
2021, you'll see some phases being implemented. So just looking at the feasibility of that timeline, there's so many systems in place, financial, there's information systems, there's the workforce load, there's the quality assurance that people are obviously questioning. In your opinion, what is the feasibility of it?
If you look at it in a different way. If you don't give a deadline and say, listen, I want it to be implemented or want to start implement at a certain date, nothing is going to happen. But is the date of 2025 realistic? No, it's not. There's, as you correctly said, there's a lot of work that needs to be done behind the scenes before one can start implementing NHI. But at least if we don't start, we will never get there. So do I think it will be fully implemented? No. No, it is unrealistic. It's totally unrealistic to think.
Also in that survey that you spoke of, there were concerns from doctors about their livelihoods, about the practice itself, about them furthering themselves within it, perhaps even related to specialization or even pursuing other vocational and occupational dreams to sustain themselves. What emerged exactly as well?
You have to understand, Liezle, that the average doctor is not interested in politics. All that the average doctor wants to know, I want to know that I can treat my patient to the best, and that there's enough funds available to treat that patient, and that I can do preventative medicine, and that I can get good outcomes in a particular system. Then, at the end of the day, I also would like to know that I would get remuneration that would sustain myself and my family in a decent way.
So in terms of tax implications and in terms of the incentives on offer for doctors under this new NHI bill, I mean, in your opinion, is there any? How do you weigh up that?
There is no incentives currently. Remember, this is only a bill, and it's still open for discussion.
Yeah.
The bill has been drafted, as everyone knows, and it's now out of the hands of National Department of Health. It lies at Parliament. And we will all have to do submissions to Parliament. Some are already submitted our submissions and where the areas of concern are. If the areas of concern can be addressed and we can come to a common understanding that this would be feasible for the doctors, the patients, and for government, then one can move forward. But up until then, it's only still a bill, and we can sit and we can discuss as much as we want. And it's not yet implemented.
Yeah, as we have been doing. So just perhaps looking at some of the recommendations that you know, is an offer from your end. What exactly have you looked at and are you recommending at this stage?
We are recommending currently the biggest issue is to double check that there's not too many powers in the hands of a single person. As it is, it's the current Minister of Health. It should not be only on administrator level. There should be much more whistles in place so that one can make sure that whoever is being appointed into these committees, because remember the minister needs to appoint some of these committees. Yeah. Now currently we've got a very supportive and understanding Minister of Health, but we don't know who's going to come in 10 years from now on. So we don't want it to be based on who your personality is that is currently there. We want it to be stable. We want to know that whoever is appointed by the minister or by the relevant group of people that then take over this power will be eligible and do the work, and not only cadre employment, but people who are there to do the work. That is one of the big things. And again, the total distrust, especially on the corruption side, that is a huge problem for the Medical Association.
Just in conclusion, Doctor, I know this conversation has been going on, it's ongoing, but just looking at, you know, the idea of universal healthcare coverage by 2026, I mean, of course, we know that it is a basic human right to access such health services. Just looking at, again, foreigners who perhaps want to access this NHI, the fund to perhaps seek medical health care, and also the actual implementation of that universal health care for everyone with the same quality, you know, as we've seen in other countries like Canada, etc. I mean, is it going to work out? Is it possible?
Well, it's possible because it happens in other countries. So why can't it happen in our country? The thing is, what we need to do is we need to engage, and we need to be part of this process. It is it's wrong to say everything is the responsibility of the current government.
Yeah.
It's not. It's all of us has got a role to play. The doctors, the patients, the Department of Health, the whole society. It's not only Department of Health. So if we want an NHI with good universal health coverage, we need all to come to the party, and we all need to start working together and say what is important. Remember also that it was said to us that NHI will not be implemented if the public sector is not on par or uplifted as where it is from this from where they are currently. So if one can get that right, if one can get the primary health care component that is accessible to all people in private and in public sector, if we can get that on par, I think we have moved a huge way in building a good, sustainable NHI forwards. If there's enough funding, if you can get rid of the corruption, and if we can start to trust each other.
All right, Dr. Coetzee, thank you for joining us, sharing your views. Of course, Dr. Angelique Coetzee from the South African Medical Association. We were just in conversation about South African doctors in private practice that have strongly opposed the National Health Insurance Bill, claiming that about 40% of doctors would immigrate if a universal healthcare system was implemented.